Frequently in my practice, we will do testing, and I start out by doing scalp evaluation testing. I'll do a hair pull test, and with this, what I want to do is I want to find out how many hairs are coming out. So we'll take a cluster of about 10 hairs and tug on it. Since 10% of the hairs are in the exfoliation phase, if you pull on 10 hairs, you should get 1 out. If you pull on 20 hairs, you should get approximately 2 hairs out. If more than 10% of the hairs are coming out when I tug on the hair, there may be something going on other than androgenetic alopecia. Biopsies can be done of the scalp. What I do is I take 4mm punches from the scalp and we send it off to a pathologist. This will help us determine under a microscope if androgenetic alopecia is the cause of hair loss or other conditions are causing the hair loss. I also will do blood tests in my practice. And what I'm checking for is I'm checking for anemia with a CBC. I'll do ferritin levels to determine if a woman has iron deficiency. Iron deficiency has been shown to be a very common cause of hair loss in women. We'll check for hormone levels in patients as well by checking for DHEAS, free and total testosterone. An ANA panel is done to determine if a person has any sort of autoimmune disease. And thyroid disease has been shown to contribute to hair loss, so we will also test for a TSH. During the pre-op, what we want to do is we want to check for general health. This helps to determine if you are an appropriate candidate for surgery. In my practice, I've found very few people not to be surgical candidates. Current medications are checked. What we're looking for here is we're looking for over-the-counter medications, which include non-steroidal anti-inflammatories or other medications that increase bleeding. The bleeding is problematic in a hair transplantation surgery because we are making recipient holes for hairs to be placed. If you are bleeding excessively, the bleeding can lead to the hair being pushed out of the recipient site. I also want to know if you're on any medications to reduce hair loss or stimulate hair regrowth, such as finasteride or Rogaine. We want to talk about drug allergies because we will be giving you certain medications during the hair transplant procedure, and this would include lidocaine. We talk about bleeding tendencies because, again, excessive bleeding during the surgery can inhibit the graft from taking. We want to talk about your smoking history. People that smoke tend to be poor healers, so we want you to stop smoking a few days before surgery and while you're in the initial phases of the healing process. We want to know about artificial joints, heart valves, and also pacemakers. A history of keloiding could be a contraindication to this procedure as well because we are making small scars in your scalp. The hair evaluation, what we want to do is we want to determine your pattern of hair loss. And with this, what we do is we use the Norwood classification for men, and this determines the extent of the hair loss. For men, again, we have temporal hair loss here, and we also can have it on the crown, and this can become very extensive. In women, we want to determine the hair loss classification using the Ludwig system, and this identifies how extensive the hair loss is on the crown and the diffuse scattering of hair loss. We want to determine the current pattern, and we have to think about the anticipated pattern. Now, anticipated pattern is a little bit more difficult in young patients than older patients, particularly in people in their 20s, 30s, and maybe early 40s. We want to know about hair density, especially in the donor site. How much hair do we have to work with? Hair color and skin color can determine how nice the result is going to be. If a person has curly hairs, you're going to have a better result than if you have straight hair. Vellus hairs are fine, wispy hairs that you see in the hairline particularly, and the extent of vellus hairs that you have can determine the potential for future hair loss. Terminal hairs we look at, and these are the thicker hairs that you see in most of the scalp. And then we want to look at the back of the scalp, which is where we take the graft and determine how much elasticity or how much movement you have. This helps determine if you're going to have a nice scar on the back where we harvest the hairs or not. For those of you who are interested in hair restoration surgery, I highly encourage you to come in for a consultation to one of our locations. We have offices in Newport Beach, Rancho Mirage, and Palm Springs. We also are happy to do online consultations as well as telephone consultations. Please visit us at www.contourderm.com.